Wikisana is also a good channel to follow our conversations further.
Welcome, dear viewers, to our format today, Natural Medicine. Knee pain can be incredibly restrictive in life. And of course, it's wonderful that we have guests here who give us opportunities for regeneration, for pain relief, sometimes also completely new individual solutions, and also patient voices. And today we learn about a very special story. Look forward to it. See you in a moment. Hello, dear Harald. Nice to have you here.
Good morning. Thank you for the invitation.
Yes, we already had some interviews. You are a specialist in internal medicine, but you also specialized in the topic of getting environmental stress out of the body, also through toxophoresis. And your second, I would say, special area is basically joint pain therapies. And what is it that you're really working on so successfully now, and you say it just makes sense to you?
Yes, I've been getting patients for over 20 years, also with primarily chronic pain. And there were always some who said, well, our knee hurts, can't you do something about it? Or the hand, or the back, or the neck always hurts. And it's a huge difference whether someone comes and has a chronic disease of environmental toxins, rheumatism, autoimmune diseases, or he just has a destroyed joint. That's completely different from the treatment. And then people said, well, if we're already there, many of them come from far away and say, do something. Then we tried with hyaluron, then we tried with platelet-rich plasma and whatever. But that didn't work with high-grade arthrosis. Then I said, come on, that's not my thing. Until at some point, I got to know the gold implantation, and it was great that with one treatment by putting pure gold around a joint, pain-free can be achieved permanently. And I said, okay, I want to learn that, I want to try that. I had myself trained. My wife is a vet, I told her that. She said, I've known that for years. Okay, wow, so since 1983, yes, with animals. Then at some point, Dr. Kierkegaard just started to do that. As the first person in the world with humans, he did that with great success for decades. And I thought it was fantastic that you really, with pure gold, with needle technique, without cutting something open, without anesthesia, just in the local anesthesia with a single treatment, can permanently free someone from his joint pain. And I thought that was great. And that's how I started, and was amazed that it really works. And we always ask all patients, after 3-6 months, depending and see, in the vast majority, there is a clear relief, a clear reduction of painkillers, or even pain freedom. And yes, we also have a patient today who has experienced that, and who then maybe can tell a little more about how it was with her.
Yes, great, perfect. Yes, Mrs. Probecker, thank you very much for taking the time.
Hello.
Hello, good morning. And of course, we're all a bit excited about your story. Maybe just the prehistory, where the pain, the odyssey, actually began.
Yes, well, it started with the left knee. There I had pain in the kneecap. There I was also operated on. There I still had a cyst. And as a result, the right knee apparently experienced more stress, and then the right knee hurt very much. And the orthopedists always said that you no longer operate on it in your age. It will come down to an artificial knee joint. And I said, no, I don't want that. And I also had a look at your broadcast here, and then Mr. Dr. Burgard appeared on the screen. And then I called him and made an appointment with him, and also got it, and he immediately treated it, so relatively soon. And so I was no longer able to climb the stairs. I gradually went down the stairs step by step. So it really hurt a lot, and I could no longer go for a walk. We always went into the forest. And that didn't work anymore, because I walked for half an hour and then it hurt, so I had to stumble. And now I got it done with him. And it took a while, but now I can walk the stairs perfectly without pain. Yes, sometimes it still hurts a little, but that's certainly when I overdo it. If I go down on the knee, which I don't necessarily have to do with the knee, but it works wonderfully with walking, that I can go into the forest again. Wonderful, really great. I am very excited.
Super nice. Yes, above all, we have so many regeneration possibilities in the body. Can you explain a little bit what gold actually does? Do you even know that?
Yes, you know a lot. Of course, you don't always know everything in life. But we know that if I put pure gold around the joint capsule, i.e. put it into a tissue, then cells of the connective tissue come and release particles from this gold. This is called dissolucitosis. Universities have found this out. And these particles lead to the fact that the inflammatory cells no longer excrete substances that cause swelling and inflammation. And when the swelling and inflammation go back, the pain goes away. And as a result, the inflammation of a joint capsule goes away, which causes the pain. The joint itself does not hurt, but the capsule around it, and as a result, the body can move again. As a result, the effects, such as muscle tension and so on, are reduced. We also suspect that the synovia, the joint ligament, is better formed again when the synovia is no longer inflamed. And then you can see that people can also walk on a joint with the most massive cartilage damage without it then leading to destruction. That they then break down at some point. We have never seen that. Even in the literature, it is not described like that. Of course, you always pay attention to every person that you make, that there is no tumor in there before, or that the joint is not destroyed. If there are many so-called rolling cysts and so on, then you have to operate it. There are also limits, but most knees can be treated. And what we also know is that so-called stem cells migrate and then also lead to partial regeneration. So that will be like new again, no question. But you can walk on such a joint painlessly, or almost painlessly. If you overdo it, as you just said, then it can hurt more again. And the University of Amherst, for example, found that if you overdo it, walk too long, dance too long, then when the pain goes up, the gold release also increases a bit, and then a day or two later, it goes down again. That is both what people tell me and what is in the literature, what has been proven by science.
But I can also imagine it super that you also combine this whole micronutrient issue. Yes, so Baker's cysts, that sounds like vitamin D deficiency to me anyway, so that you also look there.
Yes, it is of course always the case when there is inflammation. Then of course you benefit from all anti-inflammatory measures, omega-3 fatty acids, chondroitin, sulfate, and so on. But these are things that alone, in their own right, do not help such serious matters.
Yes, a combination, right?
That's why you can support it, of course. But the gold implantation alone is isolated in its effect and does what I just said and usually exceeds it.
Super, perfect, and now you don't have any other joint complaints or anything where you say,
on the knee or where?
No, I have with both knees, so the left one was operated on. But as I said, there was the Baker's cyst. That's also okay. So strangely enough, I think it goes through the whole body. I don't have any problems there either, so I can do my sport again. On Mondays evenings, I always go to functional gymnastics in the gymnastics club. That didn't work at the beginning either, that I could lift the knee. I didn't dare to do that anymore. Everything is going wonderfully now, really. The pain on the knee is gone. Everything is really gone.
When was the gold implantation? When was that again? Oh, last year. Well, I didn't write that down now, but that was already over a year ago. Yes, that was already over a year ago.
and it is getting better and better.
Yes, as I said, what I also notice is that if you move a little, then the knee becomes a little more immovable. The more I move, the better the whole thing works. So I think you have to decide for yourself how much movement you give the knee, and that you also do that. That helps. So that's definitely the case. If I can't walk now, then I already notice that the knee needs movement. That's missing then. The knee needs movement, and that wasn't feasible before. Because if you moved a lot, it hurt, and it was more pleasant to walk with it.
You know the saying, who rests, rusts. And you also know when I plaster someone that after 6 weeks of plastering on the leg, only the bone is still there. That means the body always breaks down functions and structures if it doesn't need them. And since joints are nourished by movement, by the pressure and suction principle, the joint has to be moved. Now we have the vicious circle. You move, it hurts. But if I have the bone implantation and the pain is gone, I can move again. And that's also what we advise every patient: build muscles afterwards, move, because a strong muscle system, of course, also relieves the joints. And you can do that again. And the stronger the muscles, the longer people can walk. We often see older gentlemen who come and already have very weak muscles, especially in the thigh. If the knee doesn't hurt anymore, the hip doesn't hurt anymore, the back doesn't hurt anymore, move, 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 do physiotherapy, do strength training, so that it is rebuilt again and remains preserved for a long time. And so you can maintain the mobility until old age.
Do you really use the implants in all joint structures, shoulder, hip?
Everywhere. We can make the difference in size to the point of powder, hip, ankle. You can use that everywhere.
Can I do that too, for example, if you have an operation or something like that, a stiffening in the joint to mobilize again?
So if after an operation there is a stiffening of the finger, it is usually a tendon problem. That's something else. A snapping finger you can't fix, but really arthrosis pain, osteoporosis, fractures, if all that hurts, or if there is a disc accident, because it still hurts permanently. Not with an acute accident, then it doesn't make sense. But if chronic pain is there, then gold implantation always makes sense. Where it doesn't work is when there is a tumor pain on the bone. Then it doesn't make sense at all. It's a completely different pathology, but with everything that is arthrosis, degenerative. And so, if after a rheumatic disease, if it's still around and the rest of the pain is in the joints, then it's fine, but it's not a therapy that you use for rheumatism. You used to use gold as a salt with a lot of side effects. We don't use gold salt. We use pure gold that doesn't have any side effects.
Super exciting.
You always have to know what you're doing and in which situation.
Yes, in terms of research, you said there are already these investigations. What is still being investigated?
There are universities that investigate the effect of gold on different substances. We put, not me, but doctors, we put pure gold in the brain for epilepsy or MS, or you coat it with gold stents so that they don't close, or you do research on animals as well as on people. What does gold do in the joint? There are also certain variants that you put in the joint. You can use gold in connection with stem cells for regeneration. Research is ongoing, not in the huge extent that you do it in cancer therapy, where there are billions behind it for research, but it is being investigated permanently. There are always nice investigations that show how gold works. Gomtancha and other scientists are doing a lot of research, and that will continue, thank God, and there are always new findings.
Yes, super exciting. Perfect. Do you have another question? No.
At the moment, I have no more questions for you, Ms. Probecker.
Because everything went well, so it sounds very good. Thank you very much, in any case. If the viewers I have pain, I want to try it out. Where do people have to go? What is the best practice?
The patients can contact us by email, our info@drburgard.de, or call, although we have so many calls that it is often difficult, but they can contact us, we answer or call back, and then they can learn and ask questions. They can also look on my website, drburgard.de.
Thank you very much. You will have a big target audience, I think, because you can really hear from knee pain in every corner.
Yes, it's a topic.
Thank you, and see you soon.
See you soon.
Dear viewers, it is always nice that we have patients who also speak from their experience, especially with special techniques like the gold implants. And I hope you were able to take a lot with you. Thank you for watching. See you soon. Bye.